Why are we allowing people to live in their own filth and disease?
We have a set budget and we're doing what we can.
A year into the COVID-19 pandemic and over 5 years after declaring a homeless state of emergency, local leaders face mounting public pressure to solve the growing crisis on our streets.
We are not making the progress that we need to.
Talk to you about services.
Seattle's controversial navigation team disbanded last year, and there's a scramble to move the unsheltered indoors with treatment and supportive services.
All of our hotel efforts are really just our emergency response to the pandemic.
A combination of federal dollars, a new county sales tax, and a city business tax are helping add millions to the multi-pronged effort. How well is it working, and is it sustainable?
Homelessness will get worse unless we act boldly.
Our panel weighs in.
We really need to be developing effective interventions.
Helping house the homeless, next on City Inside Out. Welcome to this edition of City Inside Out. I'm your host, Brian Callanan. Federal funding, a tax at the county level for affordable housing, and a city leasing hotel rooms and building more tiny house villages with help from local businesses. Government agencies at all levels are focused on the homelessness crisis in 2021. But will those plans bring any lasting change? That's not a simple question, with the COVID-19 pandemic straining an already overloaded local homelessness response system. But as we enter year 6 of a declared emergency on homelessness in our region, critics say it's past time for our local leaders to come up with some new answers. Longtime Ballard resident Av Barlow says she and her neighbors are exhausted after what she calls decades of broken promises from local government in dealing with homelessness.
I see enormous waste with zero accountability.
She lives 5 minutes away from Ballard Commons Park, where police removed campers last May. But now they've returned, leaving Barlow wondering if our region's growing investment in homeless services will ever net any results.
I guess I would challenge the city to show us what the plan is. At $1 billion a year, we need to see a plan. And we need to see something that's going to work.
We know that folks across the city are frustrated with the situation.
Local leaders have plenty of plans. Councilmember Tammy Morales and the mayor's office are working to replace the now disbanded police-backed navigation team with the new Homeless Outreach Provider Ecosystem, or HOPE team.
The goal here is as much coordination and transparency as possible, and not to send mixed messages.
And Councilmember Andrew J. Lewis has announced a new public-private partnership to more than double the number of tiny house villages for homeless people in Seattle. At the same time, the mayor's office has unveiled plans for a new tiny house village in the University District.
We're excited, it's shovel-ready.
Underscoring all these efforts is the urgency of the COVID-19 crisis. The CDC has advised against clearing encampments for fear of spreading disease. And shelters now have even fewer spaces with new social distancing standards.
We must continue to act urgently to address our homelessness and housing crisis.
Amid the pandemic last fall, the city launched a $34 million federally funded shelter surge and street to housing plan with 2 to 3 tiny house villages, 125 enhanced shelter beds, and 300 hotel rooms for homeless people.
All of our hotel efforts are really just our emergency response to the pandemic.
Derrick Belgarde is deputy director of the Chief Seattle Club. The city has offered the nonprofit a contract to run a 63-bed facility at the old King's Inn in South Lake Union.
We're really targeting on our elders, our most vulnerable more, making sure that they're safe.
The work is expensive and sometimes controversial because of disagreements over what the city is willing to pay.
We're still working through all of these things, and until the deal's done, the deal's not done.
Seattle's plan for a second hotel shelter downtown is now in jeopardy, and city leaders in Renton have ordered homeless people to move out of this hotel by the end of the year. But Belgarde says Seattle is making the right investment.
These type of programs will have a better success rate in the future.
Belgarde says hotel rooms provide safer and more attractive options for unsheltered people than the old congregate shelter model. But he knows hotels are just a temporary part of the homeless puzzle.
The one concern I do have is the public image. Again, like thinking that like this is going to solve and fix everything when when it's still going to be a complex problem.
We are not making the progress that we need to.
John Scholes of the Downtown Seattle Association is well aware the city and King County declared homelessness an emergency in November of 2015.
The state of emergency around homelessness has never been more dire.
The DSA has supported the public-private partnership to build more tiny house villages and Just Care, a county program that's brought more than 100 homeless people into hotels this winter. But Scholes is concerned Just Care's funding is set to expire in March. And beyond that, DSA is calling for much stronger drug and alcohol treatment on Seattle's streets.
We lost just as many people from drug overdoses in Seattle in 2020 as died from coronavirus. We need to come to terms with where the gaps and the shortfalls are in the approach that we've been taking.
To help fill those gaps, King County is planning to house half its chronically homeless population by buying nursing homes and hotels.
8 ayes and Councilmember Dunn voting no.
A new countywide 0.1% sales tax will go towards permanent supportive housing. That's where 62% of Seattle's new payroll tax on big businesses will be directed to. But coordination of all these plans on homelessness, treatment, and housing, that's still in flux.
It seems like we don't have any follow-through.
The pandemic has slowed the progress of starting a regional homelessness authority, approved by the Seattle City Council in December of 2019.
We feel the fire underneath us.
But in 2021, residents, businesses, and local leaders alike are expecting progress with a public health crisis of homelessness that took hold of our region long before COVID-19.
I think we have to confront our challenges and problems with a greater sense of urgency than we have in the past.
We have a lot to cover on this issue. We have a panel of guests to help us out with this. In fact, we have with us Councilmember Andrew Lewis. He chairs the Select Committee on Homelessness, and also Leo Flor, Director of the Department of Community and Human Services for King County. Thanks to both of you for being here. And Councilmember Lewis, let me start with you here. We are entering the 6th year of a declared state of emergency on homelessness, and the questions I always hear, I know you hear them too, are this: who's in charge here? Where's the urgency? The council approved the formation of this regional authority for homelessness in December of 2019. It hasn't come together yet. You're on the governing board of this authority. Why has it taken so long to get this organized?
Well, as of this afternoon, Brian, I can say Regina Cannon's in charge. We convened as a governing board and approved a director of the new King County Regional Homelessness Authority this afternoon. She's an exceptional candidate. Comes out of doing housing, homelessness, and justice reform work in Georgia. Really can't wait to work with her. And this is really the culmination, Brian, of realizing that we need to be confronting this regional challenge with regional answers in a regional coalition. And all those pieces are now falling into place. We convened that work last year. It got delayed because of COVID. But, I feel a lot more optimistic today now that we finally have that leader in place after a national search where we really took our time to find the right person for this really complicated role. And I think we found the right person. And I'm very proud to be supporting Regina Cannon in this new role and look forward to working with her to make this long overdue progress on the crisis of homelessness that, as you say, we've experienced for 6 years.
Thank you very much for that. Leo, just a status report from your side of things when it comes to the Regional Homelessness Authority. I know the group now has a CEO. Thank you for breaking that news. But why has this process taken so long? I know a lot of the cities that were on board with this, there's been some back and forth with them. What can you tell me about this process?
Yeah, one thing is we're making sure that we're doing this right. We are not trying to create a refractured system. We're doing the hard work of getting all 39 cities, the county, the federal government together into one entity so that we can combine all of our resources and now put them under the leadership, as Councilmember Lewis said, Regina Cannon, who we're super excited to work with. I'm super excited to have as a colleague now. So that's one thing, is it takes time to build a coalition because, as we know, Everybody agrees that homelessness is an issue, but people have different ideas about the way to move forward and what it should look like in different parts of the county. And if we're going to make something that's durable, that's going to be able to make the kind of change that the community expects of us, I think they also expect us to take the time to build the organization the right way.
Thanks very much for that. Leo, let me stick with you to talk about hotels here. The county has been leasing hotels during the COVID crisis. There's a plan to buy several of them, which we can talk about in a minute. But first, I want to talk about the Just Care program. Went into effect last year with some federal CARES Act money to lease out hotel rooms in downtown Seattle. Those dollars have dried up, and I know the county has put in some money to keep it running. However, those dollars expire in March. How long does Just Care, this emergency service, keep going? And is this program sustainable moving forward?
Yeah, Brian, I think first we want to take a look at Just Care as one of a member of a larger family of approaches that we're employing right now, which is to take folks off the street or out of congregate shelters, which we know are dangerous if they're not improved, and putting them into single room settings. It should be intuitive, but we've learned this clearly and empirically now that if you can sleep in your own bed, you can use your own bathroom, and you can lock your door, you do better. And what shelters have historically done has been really good about keeping people alive, and maybe that's about it. And what we're trying to usher in now is a new era of services where we're putting people in a position where they can not only survive, but that they can take the next step towards stability and get their help. So Just Care is one of those programs. As you've mentioned, it was funded on an emergency basis with funding that we don't have for the long term right now. We have been able to work with the Public Defenders Association that runs the program to keep it going so that we avoid some sort of precipitous loss of housing for the 150 people that are currently housed within it. When we take a look at all of the hotels we've got across the region right now, we have closer to 1,000 people in hotels. And our challenge now is to figure out a way to make this a sustainable intervention. We'll talk about the Health Through Housing program in a minute, which is a chance to make this sustainable. And I think that's the challenge with Just Care is how do we take what is a good program that doesn't have a long-term sustainable plan and then adapt it and other programs to something that we're doing continuously as we move away from congregate shelter and towards housing-based solutions.
Thank you for bringing that up. And Councilmember Lewis, I'll go to you next year because the city's Shelter Surge program has a focus on hotels too. But I know there have been some issues in coming to terms with some of the properties that the city wants to buy downtown. Can you give us the latest on what's happening with the King's Inn near Amazon headquarters and the Executive Hotel Pacific on Spring Street downtown? Are those deals going to happen?
Yeah, well, our role in how the government works, Brian, on the city council is, we appropriate the money for a hoteling program, but then it really falls on the executive departments to implement. So, I don't really have a say in which hotels they use or who they contract with. So, those would be questions for HSD on, whether specific hotels are working. To speak more broadly about hoteling as a strategy, since Just Care started up last spring, in the spring of last year, I've been a very big supporter, at least in the short term, of hoteling, just given that there are a lot of hotels on the market who are interested in participating with hosting that kind of service. It's something that can be done quickly. We don't have to go site a hotel. If you can get an arrangement with a hotel, they're ready to go. So we don't have to run into those issues that we sometimes run into with tiny house villages or modular shelters or some intervention like that. So, one thing I do want to say, just to jump onto the last question that Leo answered too about Just Care, I think we need to really look forward, as we are implementing more programs through the county-wide system. In a lot of the data and what we learned from Just Care, Just Care was really going after some of the most high barrier folks who are on the streets of King County. Folks that have serious meth addiction, people that have undiagnosed behavioral mental health conditions, and in a lot of cases, single men. And this is the chronically homeless population that groups like Third Door Coalition has been trying to organize around to provide assistance for. And they're folks that in a lot of cases fall through the cracks of some of the philanthropies and some of the other systems that are set in place. But when we really look at it, like a lot of the sort of chronic disorder issues that get associated with people who are homeless, tend to come from folks who are single men who have, meth addiction or undiagnosed behavioral mental health conditions. So we really need to be developing effective interventions. And look, Just Care has worked. Just Care has provided them with wraparound services, with a safe place to stay, with dignified casework. And those are lessons we need to take forward, because maybe if we're not delivering them in a hotel, we can deliver them in some other kind of permanent supportive housing or some other kind of setting.
Thank you very much. And Councilmember Lewis, I want to stick with you and talk about homeless outreach, if I could. The city used to have a navigation team, as you know, with a police presence to deal with unauthorized encampments. We're now transitioning to this HOPE team, a more social service provider-led group to work with this. But we're all seeing more tents on our streets and on our parks. And critics will tell you the city is enabling this activity, needs to say enough is enough. When do you think we're going to see this HOPE team make an impact, or other outreach efforts make an impact on unauthorized encampments?
Yeah, well, so any outreach team is going to be proportionately successful to the shelter offers they can make. And that includes the old navigation team. A lot of people come up to me and say, like, look, why did the council get rid of the navigation team and now there's all these tents? I mean, the reality is, the mayor stood down the navigation team to do removals in March of last year. So we had the navigation team for over half a year and they weren't doing removals anyway by mayoral order. So it's those things are not related in terms of the presence of the encampments. The reason that removals have been stood down is because we have guidance from public health officials that have said, in the time of a pandemic, you don't want to be moving people around. You want people to shelter in place. You don't want them spreading sickness if they are sick. You don't want them moving and circulating throughout the community, potentially putting themselves at greater risk of contracting COVID or some other kind of illness. So regardless of what team we have, the mayor has issued an order that there will be no removals. That's completely independent of anything the council has done.
Okay.
In terms of the HOPE team,
yes.
This is a system that's still being worked out and developed by the Human Services Department. Materially, I think it is a good departure in terms of dividing what everybody is good at in having our contracted outreach workers do the outreach, and then having city employees be a resource to secure city services to help those outreach workers in their mission, which, by the way, can include police. If outreach workers, for Reach or Chief Seattle Club or whoever they're with, encounter a situation where they think they need police presence or assistance to do some kind of outreach operation, that can be requested through the HOPE team. But people need to remember, the navigation team was not a law enforcement group. It was a outreach group that had police there for the protection of outreach workers. And I think a lot of people, Brian, are conflating the role of the navigation team, because police were present, with the role of a more aggressive law enforcement strategy. And those are separate things. So it's just important that your viewers understand that the officers on the nav team, they weren't doing law enforcement. They were there to protect outreach workers. And that was protection that a lot of the contracted outreach workers no longer felt was necessary. So that system was changed. But
thanks. I want to make sure that I let Leo jump in here too, because I know unauthorized camps have been an issue for years in our region, across the county as well. Is this problem getting worse in King County parks and public spaces? What's happening at a county level with this?
Yeah, I think we should all be clear that we have every indication that across our region, homelessness is going to get worse unless we take bold action. That's just true. One data point that I have here, we run a eviction prevention and rental assistance program for the county right now. We opened a lottery up in September. We actually closed it in October. And in that intervening about 6 months, 25,000 households across King County reached out to us and said that they were behind at least 1 month in their rent. We've been able to go in using funding from the state and the federal government and some local funding and pay rent for almost 9,000 of them. And this is just what showed up after 2 months. So homelessness will get worse unless we act boldly. And the solution to homelessness is not cold fusion. It is not yet to be invented. We know what works. It's housing. And so when we're taking a look and talking about encampments or outreach, I think the council member hit this right on. Any of those interventions will be proportionally successful based on the amount of housing that is available to refer people into. That is what solves homelessness.
Let's start down that path of housing if we could and talk about this. Councilmember Lewis, I want to talk about tiny house villages with you. You recently unveiled this public-private partnership. It takes a village. It's had some good support from the business community. I know you're hoping to build 12 villages this year. So far, much more than the 2 or 3 the mayor had originally proposed. But I know finding sites for these villages is not easy. How do you do that without making a neighborhood feel imposed upon? And do you feel confident we can see 12 of these villages by the end of this year?
Yeah, so the first thing I want to say at the beginning is tiny house villages are really, really critical shelter options, but they're not permanent housing. So I just want to get that out at the beginning for folks that that might think that that's going to be a sort of a permanent end place to live, but it's just going to it's a temporary place for people to live while we're setting them up to go to permanent supportive housing. Brian, I think you hit the nail on the head exactly in framing up that question for what the historic issue has been with getting more tiny houses. Because tiny houses are popular across the political spectrum. If you want to come up with an issue that unifies Shama Sawant, Alex Peterson, and Jenny Durkin, that might be one of the only ones I can come up with off the top of my head is a tiny house. And I think if we can really build political consensus on something like that, we should really lean into how we can scale it up. I would say this: there's been two factors that make me optimistic that we can do the siting. First factor is last year we changed the zoning rules on the tiny house villages that expanded the permissible lots they can be zoned in. Historically, they could only be zoned in industrial areas. Now they can be put in pretty much any zoning in the city. So commercial, residential, anywhere we find an appropriate space, you can put them, and that has increased the amount of possible spaces we can use. So that's the first. The second thing that makes me more optimistic is, as Leo indicated, things have gotten so bad with homelessness, and they're likely to get worse unless we do something bold. And I think a lot of us in the city of Seattle get that. And people who used to be a little skittish about having a tiny house village near them are now saying, look, if I can get a tiny house village near me instead of some of these unsanctioned tenant encampments, I'll take it. If that's what it takes to get the tenant encampments under control.
And I just want to make sure I bring in Leo here because I know the county's working on some issues with this too. You're working actually, Leo, with the Low Income Housing Institute, the service provider for our tiny house villages, as well as some churches down in Skyway right now. How's that project coming along? Are there other tiny house villages you might have in the works? Let's get a county perspective on this, please.
Yeah, I think this is absolutely one of those cases where everything that we can do that is going to be respectful of human dignity is something that we need to do to address the problem of homelessness. Tiny houses or pallet shelters is a brand that we're using in some contexts are part of the solution, and they work for some people. So we've got some pallet shelters at a bridge housing project with the Chief Seattle Club. We've got some up at an Elliott shelter that we recently opened over by Queen Anne and Magnolia. And then, as you mentioned, we're working on a tiny house village that will come to be in Skyway, although it's not there yet. And it's part of the solution. And it's something that we think can really complement other strategies that we're also pursuing. And the Health Through Housing Hotel Initiative is one of those.
Got it. And Leo, let me stick with you here. I want to circle back to the county's 0.1% sales tax that we brought up earlier, this Health Through Housing program. You're hoping to house up to 2,000 people countywide with this, not in shelter, but permanent supportive housing. I know, though, that some cities have passed their own taxes. They say they don't want to be part of this program, and cities are a really important part of this. How do you get more cooperation from them, from the region here, with these long-term plans for permanent supportive housing?
Yep. Partnership is essential here. And it's also essential to go to cities, many of whom actually agree that this is a good solution, and work with them. We're working with the city of Seattle right now. Councilmember Lewis has been really, I think, powerful in identifying some potential hotels. We're having conversations with some of those. We have other cities that have asked us to take a look at maybe a particular hotel or the characteristics of hotels that they would want us to take a look at. We'll take a look at apartment buildings. We'll take a look at nursing homes. We'll take a look at anything that can provide a single room setting with access to a bathroom and a single or congregate kitchen that we could use to provide housing for folks. And the way that we're doing this is going to cities and saying what would have to be true for you to host one of these Health Through Housing facilities so that we can jointly get ahead of and take on this issue that everyone agrees local governments need to work together on, even if it can be hard sometimes to cite a particular facility.
Got it. Got it. And Councilmember Lewis, I know that the city is also investing millions of dollars in affordable housing too. More than half of Seattle's new payroll tax on big businesses is going to go towards affordable housing in 2022. Sounds really good, but as you know, and we've talked about this for years too, we are so far behind on creating affordable units. Is there a way to bridge that gap, or where are we with this?
Well, I think the first thing we're going to do this month, Brian, is pass my bill to fast track, streamline, and expedite permanent supportive housing construction by exempting permanent supportive housing from just about every single regulation and land use control that's within the power of the city to exempt them from. It's estimated by my friends over at Plymouth Housing that those changes could expedite construction times by as much as 6 months, could also reduce the per unit cost by as much as 15%. So that's the first thing, is really looking at what can we do to be able to make up for that lost time and build it quicker, and we have a lot of power there. I think the second thing, Brian, is having as much of that money up front to make those capital investments and bond, which is what the Health Through Housing initiative is doing. That's how you do it faster. Like, you know, we're not just spending that 0.1% sales tax as it comes in every year. They say, look, let's bond against that as a revenue stream, and let's build a lot of it right now to respond to the demand that we're seeing. And so I will just make one plug, is that, you know, if you want to go fast, go alone. But if you want to go far, go together. And to the other cities in King County who have maybe, you know, stepped out of doing that 0.1%, or they want to spend that 0.1% on something else, it's like, look, we are more powerful if we're putting that all into one stack, and then we're all bonding against it together. That's how we'll get the most units. That's how we'll make the most progress.
Thank you.
So I think it's just important that we have that message united as regional leaders to say, look, let's all come back together. Let's put all that money into the united bonding pot, and let's get as much housing as we can, because we know this is an emergency, and that's how we'll get the most bang for our buck.
Thank you. I need to do a 20-second version to wrap up here. I'm sorry that we didn't touch as much as I would have liked to on some of the federal dollars coming in here, but Leo, so many moving pieces here. Federal dollars coming in, the county's working on this, the city, there's some state money too. Tell me where we're going to be at the end of 2021. Do you have a feeling about this?
Yeah, I think first we're going to control our own destiny everywhere we can. We've done that, as the council member said. We've implemented a new sales tax. We're bonding against it. We're taking advantage of a temporary economic condition to buy hotels and other real estate like that when it's artificially cheap and temporarily cheap. We have a moment, and I think the best thing we can do is maximize the resources we have control over, and then spend them in smart, focused ways to get the most housing possible.
Thanks. Councilmember Lewis, the 20-second version, your thoughts as we head into the end of, or the start and finish, hopefully, of 2021 with some better news on homelessness.
Yeah, well, let's work with Leo to get those 1,200 units through Health Through Home by the end of this year. And let's get those 12 tiny house villages stood up. If we can do that this year, there's going to be a huge noticeable difference, and we're going to be a national best practice in how to respond and deal with chronic homelessness.
Okay. All right. Thank you both very much, and we will be right back. What are people on social media saying about this issue? One person writes, "We need more shelter and more housing, and we need a plan to pay for these." Another writes, "Homelessness appears to have gotten worse and worse. I'd like to hear the conversation start with mental health and drug addiction." We'd like to know what you think. Send us an email at contact@seattlechannel.org or find us on Facebook, Twitter, and Instagram. Coming up next time, helping undocumented workers in our state make it through the pandemic. They haven't been able to qualify for federal stimulus checks or unemployment insurance, even though they pay over $300 million a year in state and local taxes. Now, lawmakers in Olympia are proposing a $70 million aid plan. We'll bring you the latest next time on City Inside Out. I hope you join us.